most people, staying home, resting, drinking plenty of fluids, if they have a fever, taking medication for that or for the aches and pains that can be accompany the flu, that's all that's required. I think if parents seem to notice that their children in particular are having trouble drinking or not drinking enough, or seem to have significant problems breathing or problems catching their breath, those would be the kind of symptoms that they should call their doctor to discuss, and then they can determine with their doctor whether or not that child needs to be seen. For the most part, for most people who get the flu, they really don't need medication, and they don't necessarily need to be seen by their doctor. But I think there are some groups of people, such as pregnant women, who really should call if they become ill with flu-like symptoms, because they would be the group that would in fact need to get treated. But most people actually don't need to be treated, and I think people can understand that if we talk about the fact that we want our antiviral medications to maintain their ability to combat the flu, and if we use them too much or indiscriminately, they could lose their effectiveness.
I would also add that except for those people with serious underlying conditions or pregnancy or with severe symptoms, we don't think people should be going into emergency rooms or frankly even into their doctor's offices. They really should call if they have those concerns. But we do have worry that people will overuse the emergency department. They may, in fact, spread the flu to other patients or to people in the emergency room itself. But more importantly, they don't need to be there and waiting for hours if, in fact, they can confer with their physician on the phone and get the advice that they would get even in coming into an emergency room. It's better for them, and it's better for the overall medical system.
And I'm sorry, go ahead.
I would also add for pregnant women particularly, there's evidence that the sooner in the course of the illness it's treated, the better the outcome. So I would encourage pregnant women who have a fever or a cough or just not feeling well, call the provider and try to sort out if medication's appropriate, because starting it sooner makes a difference.
We were getting into the treatment with antivirals. Who needs them?
Pregnant women with a fever and respiratory symptoms generally get treatment. If they're having difficult time breathing, shortness of breath, feeling very sick, not feeling, decreased energy, sometimes we actually need to see them to see if they need to be admitted to the hospital. Majority of times they do not.
Laura?
I would say certainly young children or children with significant underlying medical conditions, and by that I mean significant asthma or problems that would affect their muscles and their nerves that control their breathing. So if they have trouble controlling their secretions or coughing, those would be the kinds of kids that would probably need to be treated, and they should talk to their doctor. Diabetes, heart disease, those kinds of things, if anyone has those conditions, they should discuss it with their doctor to determine if they need the medication.